Welcome. Thanks for coming today and come in on time. A quick moment for housekeeping. There are 3 housekeeping rules in the live talk. We have muted the microphone for all attendees. For questions and feedback, please use the Q&A panel. These live talk sessions will be recorded. Hi, good afternoon. I am Dr. Tan Xion, the moderator for today's sessions, with the title New at IMU. What is Health Informatics and Analytics? I'd like to introduce our speaker today, Prof. Dr. Patrice Boursier. Prof. Patrice is a Program Director for Master in Health Informatics and Analytics in IMU. He has been appointed Professor in Computer Science in IMU and in charge of developing new undergraduate and postgraduate programs related to digital health and health analytics. Without further ado, I will pass the floor to Prof. Patrice. Over to you, Prof.
Hi, good afternoon, everyone. So I will share my slides and will explain to you what we have with this master program.
Sure, thank you, Prof.
Okay, so we are going to start in September this new program, which is called the Master in Health Informatics and Analytics. We have worked on this, it has been 1 year plus that we have worked on it. And we hope it will be very successful because we believe it's a good program for what's happening now. So let me go to the next slide. So first, what do we mean when we talk about health informatics and analytics? When we talk about health informatics, very often people also talk about digital health. It's two similar concepts. When we talk about analytics, it's a bit different, but we will explain a bit later. So globally, it combines healthcare, of course, health sciences, but also information technology and artificial intelligence. And it's one of the fastest growing economic sectors worldwide, because if you consider what's happening in, especially in Europe and the US and Australia, there are many similar programs already. They started a few years ago already. In Malaysia, this is the first program in this area. It's creating a lot of job opportunities everywhere in the world where these programs have been implemented, especially in the West at the moment. Okay, so when we talk about this digital health or health informatics, you have applications that probably you have heard about, like precision diagnosis, early detection of serious illnesses, cancer cells that can be detected using image processing, for example, when you check the images of your cells. Oncology, cardiology, radiology for cancer as well, but other illnesses. Surgery, assisted surgery using robots, for example. Drug discovery, it is something that is also growing very fast, especially nowadays when we have these coronavirus so damaging our society. And healthcare administration is also impacted by these healthcare informatics and digital health. Now, in terms of IT, computer science, computing involved, we have something that is very popular also all over the world. It's called data science or data analytics, and this is where health informatics and analytics come from. Artificial intelligence with machine learning and deep learning is also an area that is involved in this. Image processing, of course, for medical imaging. Wearables like smartwatches and Internet of Things, and you may have a watch that is connected to your computer and the internet, and all your data are processed, and you can check your blood pressure, your pulse, and more things to come with this. Robotics is something that is going to be used a lot also. It's already used for some surgery, but for helping old people or people who are disabled, robotics is something that is very important. And something that you don't see much at the moment that will be very successful in the future, it's augmented reality and virtual reality. For the moment, children and adults as well, are using this for games. But in the future, you will see that this will be used also for surgery and other applications. So we are going, in fact, from hospital-based to home-based care, which means that you will go to the hospital less often, and you will use wearables and Internet of Things devices that will be connected to internet, and your doctor will be able to receive your data, later be related to your health, and they will not need to see you so often, except when it becomes severe, of course. We will have also AI-powered alerting systems, like, for example, with some watches now, if you fall, suddenly your watch can tell you what happened, and your watch is able to call someone or emergency services so that they can help you. Virtual assistants, they already exist also, and they will be developed in the future much more. And probably we are going to see something called augmented medical doctors, because we will still have doctors, of course. They will not be replaced by robots, at least not in the next few years, but they will be helped by computers, artificial intelligence, robots, and all these things. And so more and more patients will take ownership of their care, not alone, but they will help doctors to treat them and to know what's happening to them. These are some examples of what you have. You see here you have shoes. There might be some, it's already exists, in fact. You have sensors in your shoes that can detect how you walk and if you have any problems with this. Sleeping quality also, using a smartwatch. Using some sensors in bra, you should be able in the future to detect some anomalies. And you can talk with your doctor using your computer. You can also use your computer or your smartphone to input some information and to check. And also you can see here, you can have some data coming from measuring your what's happening to your fingers, like your pulse. And maybe in the future also you can check, you can have some blood tests implemented in those devices. So as you can see in this article from the Guardian recently, it was in January 2021. In the future, we will talk about hospitals without walls, because this is what's happening. The doctor might be in his cabinet, in his office, or in the hospital, but you are at home and you are communicating with them. And you don't need to go to the hospital or to the doctor's office all the time. So why this is important for us, for the society, and for you in particular when you are looking for a job? One of the very big issues in Malaysia at the time is what we call diabetes. And there are a lot of people who are working on trying to work on diabetes, to prevent it and to cure it. And it's a very big issue in many countries, and especially in Malaysia. So a lot of research is done on how to work on this. Another way to prevent diseases is to be conscious about food, what you eat and how you eat, not only for diabetes, but for other illnesses as well. Eating less is something that is important, and eating well also. Recently, the Prime Minister of Malaysia was mentioning about COVID-19, that the healthcare system is at breaking point. It's not only in Malaysia, it's happening in many countries at the moment, especially in the US, for example. And this is something that might be even worse in the next few years if we have some other viruses coming. And that's why we must work on it and do some research using healthcare and computer science, artificial intelligence. We need to work on this. And so you can see on these slides that the Malaysian government is working with some other people, like you see AstraZeneca, the famous pharmaceutical company, Sweden government, and some companies as well, to work on digital health and what we call non-communicable diseases. That is, for example, diabetes. It's something that it's not contagious, but it's something that affects a lot of people. So a lot of research is being done and will be done in the future as well on these aspects. So now we are launching this Master of Health Informatics and Analytics, and I will try to explain to you what it's about. So this program is not a master in science, meaning that it's open to people with any background. I mean, a bachelor, it can be in IT, computer science, but it can be in health sciences, medicine, but also business and other areas of study. So anyone with a bachelor can enter this program. It's also open to people who are already working adults in various areas. They don't need to be specialized in IT or healthcare, and they can change, in fact, the way they work or get new jobs using this master program. And in particular, it's open to people who are also already in the healthcare domain and looking to do more, in fact, to learn about what they can do using computing, artificial intelligence, to have a better knowledge and to be better skilled in this. Now, the duration of studies for this program, as you can see, in fact, we have 3 programs in one. It's a master program, but you can exit after 6 months, after 1 semester with a postgraduate certificate, or after 9 months with a postgraduate diploma. And you can extend in some cases, with some circumstances, you can extend. So as you can see, part-time, it's a bit longer also. The program structure here. So we are using blended learning, meaning that hopefully we will be able to have some face-to-face in the future when we start in September, but we will still have some online learning so that people can work on their own pace and come and work with us from time to time when we need to explain to them something and work on projects. So it's blended learning, and it's modular because we will have, as you can see later, we have a few different modules and we teach them in sequence. So it's easier for people who are working already. So we have, like most of the programs, we have lectures, tutorials, case studies, assignments, group projects, and you will have to do presentation and discussion boards. So all this is quite standard, and we will have the same. The people who are involved in teaching this program, so Xion and myself are experts in computing, computer science, but we are also working with colleagues from IMU who are health-related specialists, like pharmacy, medicine, dentistry, and all these things, and they will be involved in teaching and in projects as well. And we will also have experts from industry who will be involved in forums and in projects as well, and also for internship. Okay, so on this page, on this scheme, you can see the 3 programs, PG Cert, PG Deep, and Master, and all the modules that we have. So for the first semester, as you can see, we have 4 core modules: Health System and Informatics, Data Collection, Data Analytics, and Data Management. And these 4 core modules are compulsory for everyone. Okay? People who do the PG Cert, they will have to take 2 more electives, and then they have 20 credits. They can exit if they want. If they want to continue, then they can go for the PG Deep, where they still have the 4 core modules, 2 electives during the first semester, but they will also have to take 2 core modules, Advanced Health Informatics and Data Visualization, in the second semester, as well as 1 elective. And finally, people who want to get the master, they will take all of these, but in addition, they need to take research methodology and scientific writing, 2 credits during the first semester, and also project, and also they have to take 1 project, a big project, 10 weeks project, at the end of second semester. And altogether for them, it will be 40 credits. So 20 for the PG Cert, 30 for PG Deep, and 40 credits for the master program. On the right side, you have the list of the electives that people can take. And you have to be very careful with the first 2 modules, 2 electives, statistics thinking for health analytics and introduction to computer science and programming, because these two electives are compulsory for those who have never done, learned or used statistics or computer science and programming. So if you have done one of these, then you don't need to do this module. But if you have no background in these, you have to take them during the first semester. So this is very important. And these two electives, in fact, they can be used as the two electives that you need to take during the first semester. Okay. Now, just a bit more details about these modules, prerequisites. So as I said just before, 2 credits for each of them and compulsory for those who have no background, either in statistics or in programming. Then the core modules of the first semester, we have health system and informatics, and that will talk about emerging trends and governance in global health, functions and building blocks of health system and health informatics. And health data collection and preparation, which is, the first one is quite a general module, it's not very technical, but the second one is quite very important because it talks about how to prepare data, collect and prepare, clean all the data and organize them so that you can do some data analytics and visualization later. And most of the time we talk about data analytics and data visualization, we forget that data collection comes before that. And people who work on data science and all these things, they spend most of their time, in fact, on data collection and preparation. It's between 60 and 80% of the time that is spent on this. And it will always stay like this. Then you have health data analytics, where you will learn about the basic concepts of machine learning, the algorithms, like supervised learning, unsupervised learning, and all this, and also deep learning. So it's one of the core modules. And finally, the last core modules for the first semester is health data management, which is related to database management, what we call big data management, and how to organize and manage data for data analytics. So it's complementary to the previous one. Remember, we have data collection and preparation, but data management is complementary because you have to store and organize the data that you have collected and cleaned. So it's also very important. Next, during the second semester, you have 2 core modules, Advanced Health Informatics and Data Visualization. So Advanced Health Informatics, it's an introduction to advanced application of these health informatics or data health, digital health. And in this module, we will explain to you what people are doing now with AR, VR, augmented reality, and virtual reality, and all these new technologies that exist in computing and that are being applied now to healthcare. And finally, data visualization is the one that allows you to visualize the results of the analysis phase. And when you go online and you look for results of, for example, what's happening with COVID-19 now, you see nice drawings that show you what's happening in the world and what's happening in Malaysia in particular. And this is done using data visualization tools. So of course, it's also very important. If you go for the master program complete, then you will need during the first semester to take research methodology and scientific writing. It's something that is compulsory for all master programs. And so it's a 2 credits module. And finally, you will go for a 10 credits project related to one of these areas. And this project can be done in a company. So it's a kind of internship in a company, but it can be a research project done at the university as well. So depending on what is your background, what you are doing, what you like. And for example, those who are already working adults, they can work on something that they are already working on in their company. We can check what they are doing and decide on the content of the research project based on what they are doing. Finally, the electives, as we said before, we have 2 electives for the first semester and then one additional module for the second semester. So the electives are either business-oriented or medical science-oriented. So we have a few modules, so you may choose among these. But remember that if you have no background in computer science and statistics, then you must take the 2 electives at the beginning of the program. And then they will, you will not have to take all these. Entry requirements, it's standard for master program, either bachelor degree or equivalent with CGPA of 250. And if your CGPA is less than 250, then you must have 5 years of working experience. But we consider the application that we receive, and we will interview you in case you have any problem and you don't know exactly what's happening. Now, finally, what you can do with this program, career opportunities, you can work in health-related industries in the private sector, either specialized in IT or healthcare. You will have both competencies, but you can specialize in either of these, depending on what companies are offering and what is your preference as well. Ministries and departments in the public sector are also investing a lot in digital health and health informatics, and there will be more jobs coming in the future in Malaysia as well as in other countries. It's already the case. And there are also opportunities for further studies for those who want to do a PhD. After the master program, they can enroll in the PhD. So upon graduation, students will be able to, for example, serve as subject matter expert in a team, because they are supposed to be good in both areas, computing and healthcare. And they will be able to develop processes, structured processes, to ensure that the data that the company wants to use are available, they can be used, they are clean, and they are also they have to be involved in security aspects of this data. You have to protect, of course, especially with medical data. It's very important to be very good in security. Another aspect of what the students can do, utilize a wide variety of methods and technologies to support decision-making using data analytics and data visualization. And finally, the students who have done this program should be able to utilize innovation and system thinking to move the organization forward. So they should become an asset for the company or the government who will use them. Thank you for your attention, and now we are open to Q&A session. So I will let Dr. Xion take back.
Thank you, Prof. Patrice, for the insightful talk and also the information regarding informatics and analytics in healthcare. Participants, attendees, you can actually write down your questions under the Q&A panel in Zoom. So while you are setting or typing your questions down, Prof. Patrice, I have actually a few questions regarding the program. So for example, if you have international students, do they actually have to sit for English test before they actually enroll to the program?
Not necessarily. It depends on their background. If they have studied in English, then it's not compulsory. They don't need this. There are English requirements that are published. I didn't include them in my slides, but they are published on the website of the program. I believe we will give them the participants the website later, so they can go and check these criteria.
All right, the questions is actually coming in. I will read out the first question first.
Okay.
Yeah. When are the classes held? Would it be weekends?
Oh yes, I forgot to mention this. Right. Yes, the classes will be held on weekends because we are focusing on working adults, and so it will be on mostly on Saturday. But if we need to have classes on Friday night or Sunday, it might happen as well. And even if we have problems with the availability of some people who from industry, it might be in the evening on the weekdays.
Yeah, to add on, we actually have a portal to basically video record our lecture online due to the fact that at the moment we are unable to go to the campus or attend classes. So all this video will be uploaded to the course platform, right, Prof?
Yes, yes, everything is uploaded, including this talk, in fact.
Yeah, that would be good so that the person or actually the students are unable to attend classes, at least they can review back to what we actually have lecture or task given will be all listed in the online platform.
Yes.
Yeah, next question. I only have diploma in computer study and I have been working in healthcare IT for almost 26 years. Is MHIA able to, will he actually or she able to enroll to HIA program?
We have to be careful with the MQA requirements. Based on the experience, 20 plus years, I believe it would be possible. For me, it would be possible, but we have to be sure that it's acceptable by MQA. So we will check the MQA requirements and see if we can do it. In my opinion, it should be okay, because if you have so much experience, it's good enough, but we have to check.
Yeah, perhaps you can actually submit your CV as also including your certificates.
Yeah.
We can actually go through and Prof. Patrice will verify, and from there we will be able to confirm whether you can enroll to the program.
Yeah.
Yeah. So next question. Would non-science graduate cope with scientific writing and research methodology?
Yeah. In fact, the contents of the modules are adapted to people who are non-science students. So research methodology will not be not as difficult as the research methodology that we have for science students who are going for a master in science. And this one is not a master in science. It's the master program, but not master in science. So I believe the students who are, I not only believe, but I'm pretty sure all the students who are non-science students will be able to follow as well.
Yeah, actually, we will be guiding you if you are unable to follow the scientific writing and so forth. I believe myself and Prof. Patrice went through the journey as well. And we do struggle, but after that, we learn a lot from the writing.
Yeah.
Yeah, it's a learning process, I will say. It wouldn't be saying that it would be very difficult to non-sciences to cope with scientific writing. It's basically the same. It's basically trying to convey your idea and also uh, build the idea out from what you have at the moment and see how things actually end up, I will say, the result of it, of your research.
In the past, I've worked with non-science students as well, and students who were in geography or environment, and I never have had any problem to work with them, and they were able to follow quite well, no problem.
Yeah, same here. We actually have students from everywhere when we teaching the bachelor in IT as well. Well, most of them can cope without problem. But I would say that effort actually play a role when you have the interest as well, and the attitude is very important. And the lecturer are always there to help if you have questions.
Yeah.
So next question is, what make your course different from the course offered by UKM, FTSM, Master in Health Informatics?
The programs that are offered, it depends when it was open. If it was open just now, I don't know. But I checked, we checked all the programs in Malaysia last year, and there were a few programs which are Master in Science and Master by Research. So this one is not a Master by Research. It's a master program where we have courses, and at the end you do a research project. But it's not a master by research. And most of the universities who are offering data science, for example, in Malaysia, it's mostly master by research. So I will check later, but I believe this one at UKM is also master by research.
All right. Thank you. The next question is, can I enroll in master?
Sorry?
The next question is, I think one is follow from the diploma students when he
Yeah.
has a diploma in computer studies and have 26 years working experience. So the next question is actually asking is, can he enroll directly to the master program?
We need to check. We need to check with the MQA requirements, because what is written in the MQA requirements is you need a bachelor program. But I know that there are some possibilities in some cases, some special cases, we can work it out. But we still need to check to be sure that there is no problem with MQA. We will contact you later. We need to check. You can leave us your coordinates, your contact, and then we will tell you.
Yeah, you can drop us a message, and even so, you can actually attend the live open day on this Sunday. If you don't mind, then you can actually get the brochures for this program, including some more understandings on your requirements that you have.
Okay.
So the next question is, how is classes schedule or timetable going to be? I think we have answered during the weekend and also Friday. Are the on-campus or online classes conducted on weekends or weekdays?
Yeah, weekends, mostly on weekends. Only weekdays evening, if need be, for some, if we have some people from industry who are not available otherwise. But otherwise, on weekends, yes. And something, we will have a block teaching also. That is, we teach one module at a time, except for electives that can be taken at the same time. But the core modules, we have one core module and then another core modules and then another core modules. They are not taught all at the same time. Okay, so that's called block teaching.
Oh, okay. Maybe Prof can explain a little bit more about block teaching versus the traditional teaching.
Yeah, it means that instead of having the 4 core modules in parallel during the first semester and electives at the same time, the 4 core modules come in sequence. So we teach first the first core modules, then the second one, then the third one. So if we have, for example, 16 weeks, then it will be 4 weeks for each of these core modules. That clear?
Yeah, that means that we can actually deliver the module by sequence. So you no need to like doing 4 assignments in the same time by completing it in the same time. But in this sequence, we can actually give some leeway to say that you complete the first assignment for this module, including the second, and followed by the next subjects and so forth.
Yeah.
So I hope that we answer your question.
Yeah, but we can have electives, because electives are not so, it's only 2 credits, and electives can be taken at the same time, depending on the availability of the elective, because most of these electives are given by other departments, other schools in IMU, and we cannot decide on when they are available and when you can take them. So what I'm saying is for core modules mostly. Yeah.
Okay, understand. Yeah. So will there be any industry training for this course?
Yes, there will be people from industry for each of the modules. Each of the core modules, we have people from industry. We have already contacted them, and they agree to come and give some talks, have some forums and discussions on their topics. Yeah, so for each core modules, there will be someone from industry coming.
Yeah, I would like to top up this. If I were to understand the questions, they will not have a module called industry training like the degree program that you will be placed in the company for 4 to 6 months. This one, we have it replaced by a project. So project that actually tag along will be that you have to write a scientific report, and from there you also engage with company with the project or with the researchers in IMU. Then we doesn't actually need the students of MHIA to be placed in the company. But whereas if let's say you are working in a company already and they have a project which actually wants you to work on, you can actually bring it to IMU and work on it. So it's like killing two birds with one stone.
Yeah.
Yeah.
Okay. Yeah, something I forgot to tell also about the modules. We are working, it has not been done yet, but we are working on the possibility of offering what we call micro credentials, meaning that each core module could be delivered as a standalone module. And this is mostly for people who are working so that they can take one module and then if they cannot take all the 4 modules at the same time, they take one module and they can come for another module later. So we are working on it, but for the moment it's not advertised because we have not finalized it yet. But IMU is working on micro credentials.
All right. I think we'll follow the next question.
Yeah.
Is the career opportunity between the postgraduate, certificate, and diploma master different from each other?
A little bit, because between PG Cert and PG Deep, you have 2 core modules in the PG Deep that you don't have in the PG Cert, which is Advanced Health Informatics, where you see advanced computing technologies that can be used in the healthcare sector, and also data visualization. In fact, you do a little bit of data visualization when you do data analytics, but in the second semester, this module, health data visualization, is also an important one, and it gives you some additional skills. So there are jobs that you cannot take if you have not done this. And finally, with the master program, you have a real master. So it's a complete postgraduate degree, and you have done a project, a big project, and this is something that gives you also more skills and more possibilities for jobs. Okay.
Yeah, agree. Actually, different level have different experience, and when you reaches the master degree, that's where you have the full package of master. Unlike the research oriented master degree where you focuses on one project, but this one we actually introducing courses which is related to informatics and analytics. So I would say that it's more on guided learning and also a little bit of independent learning includes.
Yeah, people have to understand that when we talk about digital health or health informatics, it covers a lot of different technologies that we have in computer science now, or informatics, because it covers, as I said before, it covers databases, robotics, image processing, even blockchain now for security aspects. So there are many, many things that you have to understand. If you do a master by research, you don't see all these. You focus on one, as Xion said, you have to focus on one topic and you work on this. In this program, you see a little bit of all these technologies. So at least you know what is available and what you can use.
Okay. Yeah, and also the project, we don't limit you to be actually have to be very scientific or heavily medical related. Like for example, it has to be deal with the cells or bioinformatics and stuff like that. If you're actually from a non-science background, you can actually have more on the business-oriented focus, but looking into the angle of what you see there's an opportunity in analytics and informatics.
Yeah,
Am I right, Prof?
Yeah, even insurance companies. And if you are involved in the administration of a hospital, for example, you need to know more and more about computing now. You need to know how to administer a system, and you need to understand all this. Even if you will not be the one who will do all the programming, because you need specialists for this, but you will understand what they are doing, and you will be able to tell them, you have to do this, and I know what you are doing.
Yeah, not just small changes where you have to pay a big buck, but at least you get to understand that after learning, is that, hey, you can actually do this way around instead of what you have mentioned. So people are well aware that, hey, this, you don't play with me, I know my stuff.
Exactly.
Yeah. So we'll move on to the next question. Any example of current jobs opportunity or prospects can one pursue as a graduate of this course in Malaysia?
Yeah, I think we have put on the brochure and in the website, we have put a few examples. Like it can be typically, because it's called Health Informatics and Analytics, you can be a data analyst because we will teach you how to analyze data sets. You can specialize in data analytics or data visualization or data what we call data engineering, data preparation and cleaning. It depends on what you are, what is your background and what you like. But you can specialize in any of these areas. Or if you are not very interested in all these scientific domains, you can go more for the administration of the data. And yeah, you can go more into the business applications or some of these.
Yeah, that's very true. There are plenty of job opportunity, as I can say, and especially not only in the hospital, but there's a lot of startup IT companies also trying to ventures into healthcare or even mobile applications related to digital health. So I think with this degree, at least they are able to get the fundamentals of it and venture into a new opportunity in healthcare.
Yeah, whatever your background, in fact, when you do this, you will have a double competency, at least a double competency, because you will know about the computing aspects, and you will know also about the healthcare sector if you have no background in health. But in addition to this, if you come from business, you have this additional competency. So it's always good nowadays. It's always good to have not only one competency, but at least two. It's much easier to get jobs if you know a bit of computing in addition to something else, for example.
Yeah, at least there's some fallback if one doesn't work out. Examples: pilot couldn't fly a jet or a Boeing already. At least they can actually come over and join us.
Yeah, if you want to be a software developer, like a hacker, a real one, then this program is not the one for you. But you can start like this, and then later you can you can specialize in software development. But it's not what we are doing. We are not focusing on only programming. Programming is part of the program, but not only. Okay, so you will get a few different competencies, but don't think that you will be a hacker when you do this program. Unless you have a background in computing already.
Yeah, usually hackers starts when they are 10 years old or so, when they actually really happy to sit in front of the computer for the whole day, and that's where they pick up from young. It's not so easy to be a hacker.
Yeah.
Yeah. Let's move on to the next question. If I join full-time and find difficulties and to complete it, can I change to part-time or extend the durations?
Yeah, it's flexible. You can do it. Yeah, no problem.
In fact, I think we can let the students to enroll into master first. And if let's say they would like to exceed in the certificate level, they could, or even in the diploma level. Am I right, Prof?
Exactly, yes.
Or the other way around?
Yeah. We push the students to enroll in the master program first. If they want to stop at the PG cert, they can exit without any problem, and PGD as well. Yeah.
Yeah, of course, we would like to hear from you as well about your difficulty.
Yes, but you can also extend. If you have any difficulty, you can extend. You can go for part-time. We can talk about it anytime.
Each program have a maximum duration, right?
Yeah. It was in the slides. It's also on the website. You can check this.
So let's move on to the next question. Is there any industry visit or internship or practical in the program?
Yeah, the last module for the master program, the last module is 10 weeks, and it's we call it research project. It can be done either in a company or in the IMU with some researchers. So it can be research oriented or industry oriented. And for people who are working in a company, they can use what they are doing. In fact, the research project can be based on what they are doing in the company. We have to talk about it. We have to check what they are doing. If it's too simple or too complex, it might be difficult to finish it in 10 weeks, for example. But if we can adapt it, and we can use their projects for this.
Yeah, in fact, the start of the proposal writing or even engaging the company will start in semester 1, right?
Yes, when you do if you go for the master program, you do research methodology, then you define your proposal. You can define your proposal, your project.
So let's move on. If the class is face-to-face, will it always be online while the class is on? I am not living in KL.
Classes, in fact, we don't know about the situation. We hope in September it will be better. So there will be face-to-face classes in KL. They will be recorded, and you can attend also online. For some projects, for some practical work, I think it's better for students to come on weekends and attend these sessions, because for example, when you do programming, some programming, it's difficult to do it online. We have experimented this before. It's not easy to explain and to check what the students are doing if they are not in the lab. So in fact, part of the modules will be done face-to-face, and part can be done online, completely online. It depends. And of course, we will also ask you to read some documents and to check some videos, because you have so many resources online now. You can use some of them, no problem.
Yeah, so that means that we actually unsure, but definitely there will be two modes, right? The face-to-face and online.
Yeah, it will be blended learning. Yeah, it's not. It will be difficult to have it fully online. If we are still in confined and the lockdown, then we will manage to do it. But it's much easier, much better for everyone if we can have blended learning, partly face-to-face, partly online.
Yeah, actually, I find that whenever we have face-to-face meeting, it's much more easier to convey the message than having an online meeting like this, because we can actually show it, or somehow the human touch does actually make difference. And the time actually, we actually save a lot of time if we have a face-to-face meeting or even classes. But if things doesn't work out in this way or that, then yeah, we definitely still will go for online classes.
Yeah.
Last two questions. Does the course commence in March? If so, when is the final date to register?
This year in 2021, we will start in September because of the situation. We are not sure what will happen. So we have decided that the first intake will be in September, but the following years, then there will be two intakes per year, March and September. But this year it's only September. So I don't know when is the deadline for registering, but you have enough time now for September, no problem.
Yeah, if let's say you would like to enroll in the September intake, you can always join the open day online on this Sunday. I think later I will give an announcement of some discount.
Okay.
Yeah, most of the time open day will have to come with some discounts in all the university.
Okay.
So perhaps you can actually make use of this opportunity to find out more, or even have some discount if you enroll. So the last question is, may I know where can I find more information about the fee structures for the course and my fundings available, or any fundings available?
Okay, the fees, it's online, it's on the website. It will be in the brochure as well, I think. And if you have any question about how how to pay, how to fund your studies, I think you have to talk to the admission office and see what is possible, because we are not specialized in this. But there is some information available online already. Huh? You can go to the website, it's already there. Yeah.
Yeah, I think it's quite standard that if you are alumni from IMU, you can actually get straight away a 15% discount. Yeah, you can actually speak to the admissions department regarding this, but I think they will also have some guidelines on if you have financial issues to pay for the fees and so forth. So not to worry, just have to approach us and then see what the admissions office can actually help on it in the fees and so forth.
Yeah.
Yeah.
I wanted to add something about because we didn't talk much about our background. So myself, I've been a professor in computer science for many years. I've taught computer science for many years.
Definitely more than me.
Yeah, almost 40 years. So initially in France, I was a professor in Paris and then in another city in France. And I've been a professor in a few universities in Malaysia. Previously, before joining IMU, Xion and I were with Taylor's University. I was the head of the School of Computing, and Xion was one of the program directors there. So we have a good background in computing, no worries. And we will recruit at least 2 new staff by end of 21 when we start the programs. And we also have internally inside IMU, we have one colleague, Prof. James Walsh, his name, I'm forgetting. He's in charge of the foundation in science, and he will work with us as well. And we have also some colleagues from medical sciences and pharmacy and other schools who are working with us. So we have a very good team, and we won't have any problem with the lecturers.
I think we have quite a good combinations here that we are the computer scientists and IMU have a lot of healthcare experts, including the fellow doctors, medical doctors, that they can actually give a lot of insightful about how hospitals are actually organized and how the medical records are basically available. And I understand that for informatics and analytics, we all rely on data sets. We also in the midst of talking to other partners in the UK and around the world to obtain those real data.
Yeah, it's important. Yes, we are currently talking to University of Liverpool, Ulster University. We have a talk with them next week where we will have an online meeting. And there was another university also in UK who was interested to work with us. I also have one former colleague from France who is now in university in US, and they are also starting a master in health informatics and analytics. So for the moment, we are talking to them to see how we can work together, but we will have this combination. And there will be research. At the moment, we have not started research in health informatics, both of us, because we have no time for this, but we are starting, and we focus mostly on our education program, on the master program for the moment, but later we will develop some research aspects of it so that those who are interested in a PhD, they can work with us as well.
Yeah, so not to worry about that. Actually, we do have a sort of a glimpse of the fee structure already, but we haven't really officially finalized yet. But it's about 40,000 for master degree, then 20,000 for the certificate and diploma. We have it as 30,000. So from there, you can actually see whether if you have or you need any financial help, do speak to the admissions.
Yeah, but the
And yeah.
website, it's on the, it will be on the website there. When the website, I don't know
Mm.
if they have made it available, but I saw the information is on the website.
Yeah, actually, so they already put it up, the available informations except the fee structures
Okay.
soon to be verified and approved. Then we will update the website. And participants and attendees over here, maybe they can actually blast out your information once everything are finalized.
Yeah.
And yeah, actually, I have one questions in the private chat here.
Mhm.
You basically they were asking about the coursework. Is it fully coursework, or is there any written exam or any assessment tools that we basically going to use for this course?
Okay. There will be very few final exam. I think maybe one or two modules. I don't remember exactly, but we usually don't practice. Personally, I don't use final exam with a lot of questions. I prefer to have projects. So we have, in fact, we have continuous assessment. That means during the sessions that we share together, when you come to the university or online, you have some assignments. You have to do this, and then you have projects. So it's mostly this. And for some modules, sometimes we need to have a final exam, but not for all the modules. Hmm?
Yeah.
So
So yeah, over to you, Prof.
yeah, personally, I don't like so much the final exams. In some cases, it's interesting, but most of the time, it's much better to have continuous assessment and projects. And when you have a group project, we will have also interviews because when you're online, it's very difficult to know what you are doing. So you will make a presentation, and we will ask you some questions to be sure that everybody is working on the project and not only one person doing and the others getting the mark. So we have to be fair with everybody. Hmm?
Mm.
And I forgot to mention something about our background. We are computer scientists, but not hard computer scientists in the way that we have worked on applications as well. Xion will explain to you what she has done. And myself, I have developed some medical information system for clinics in France as well. So we have worked on applications, and we are not just focused on programming. Don't worry. Xion? Hmm?
Yeah, been in the teaching line for about 15 years, so been guiding students before they enroll to the program, which is more like this setting or open day, and also during the program. And even we still keep in touch after they have graduated. And most of my students still come back to me with some consultations and stuff like that without fee charging lah. Yeah, so more on this is we do still keep in touch with the students, and most of the students graduate from computer science, IT, and also software engineering, and embarking to this digital health and also informatics and analytics, which is very new. Perhaps a lot of opportunity, I would say, to basically work together and move forward to carry this digital or health informatics transformations, yeah, digital transformations in the healthcare. Because you can see that a lot of opportunity if you can read the news that Prof. Patrice have shared during the slides. Uh, yeah, this is some highlights.
Hmm. Hmm.
Yeah. Before we end this, please remind that we have a virtual open day this Sunday, 24th January 2021 from 10 to 4. And you can actually register for this open day online at imu.edu.my/open day. And highlight of the open day is, like I've mentioned, there will be application fee waiver up to 800 for all the program, except for medical or medicines and dentistry. Terms and conditions apply. And there will be a live chat with our faculty member as well. Yeah. So thank you, Prof. Joining today's virtual live talk about Master in Health Informatics and Analytics. And I myself is also a part of the team to lecture and teaching this program. And more programs to come if you are enjoying for these sessions and also the live talk. Yeah.
Thank you, everyone, and hope to see you in September.
Yeah. All the best. Stay safe. Thank you.
Thank you.
Thank you all. Thanks for participating.
Okay.